Hello, my name is Naida Masak. I'm a student here in Nightingale College. I'm wearing my uniform attire. I also have my badge. My nails are clean. I have nothing on my hands. Hair's up. This is a simulation video on tracheostomy care. This is my patient right over here, Mr. Smith. I'm here to take care of his tracheostomy. Um, First things first is we have to confirm the patient's name, date of birth, make sure that the patient's 5, 6 rights are checked off. So name, medicate, name, so right patient, right medication, right dosage, right route, right time, and right documentation. Make sure to check 2 documentations, including with the MAR. If the sectioning is needed to be, make sure that the patient the oxygen mask and everything's not on the patient's face. And the patient give you a thumbs up when he's ready to go. Make sure that he's comfortable, answer any questions, and like I said, make sure that there's a doctor's order stating that the tracheostomy care needs to be done. Okay, so first things first, I have my kit right over here. I have my patient, Mr. Smith. So I'm going to perform hand hygiene. And we're going to go ahead and put the kit away from the body. We can go ahead and touch the outer area of the corners of the star gloves, including the sterile field. So we're going to go ahead and take the gloves, and then we're just going to place them to the side right over here. Quarter-inch margins we can go ahead and grab. Make sure too that you're only grabbing the sterile field, and then make a sterile field. And then what we can do is we grab our fun stuff, making sure that we go and place this over the sterile field, just like that. Go ahead and put this back, kind of away from the corner over here. On top of the chamber of air, that area, is we're gonna go ahead and combine it with saline and hydrogen peroxide. And then the 2 little chambers is going to be just normal saline. Okay, so let's go ahead and do hand hygiene. Patient's telling us it's okay to go ahead and proceed. I'm going to go ahead and put on clean gloves. We're going to go ahead and gently take off the dressing. Unlock the trach cannula, unlock it. I'm going to go ahead and pull it out gently. And then what we're going to do is we're going to go ahead and put it in the top bin. Okay. Patient's doing great. Everything's still secure. So we're going to go ahead and do our sterile field. Okay. So now we're going to go ahead and grab our gloves. Like I said, you touch the outer corners only. We're going to take the non-dominant hand, and then we're going to stay away from the sterile field. And then we're going to go over here, and then we're going to go away from the sterile field. Okay. Grab the inside of this area away from the sterile field, and then we can drop it. Now we're still sterile. Okay. So now what we can do is we can kind of organize what we have here. So we're supposed to have a couple gauzes, our trach brush, and several Q-tips for the cleaning. Okay. So we're going to go ahead and take the trach. Take the brush, clean it around. Get rid of the brush. Now we're going to put it on here. And let it soak for a little bit. Okay. So now what we're going to go ahead and do is we're going to go ahead and grab the trach. Place it back into the patient's trach. Go ahead like this and lock it in. Make sure it's locked in. So we're no longer sterile with this hand. So what we're going to go ahead and do is grab our nice little Q-tips, put them in the basin here. So we're going to go ahead and clean that up. Around, garbage. Around, garbage. Around, garbage. Around, garbage. Around, garbage. Okay. Now we're going to go ahead and take some gloves. Take some gauze. And then we're just going to make sure that everything is dry around the trach. Okay, that's garbage. So changing the tracheostomy ties, they always have to be done with two people. So when I change the tie, there's going to be another second person. So making sure that we have everything we need. We have a new gauze that goes around it. And then we have our new tie. Okay. Everything's clean. So let's go ahead and put this around. Making sure that the patient's comfortable. You're not tugging around. This is two-person procedure. So now we're going to go ahead and change the ties. We're going to take this nice clean tie. We're going to remove by holding the side around. This is done with two people. Okay. Making sure that the ties are gently around the patient's head. There's no kinks. Like I mentioned, this is a two-person job. Make sure that there is a nice there you goes. Tying a nice knot. Grab a piece of tape. Make sure you put small little gauze behind the knot for comfort. And then what we're going to do is tape the knot so it does not tear apart. Okay. Now we're going to put the patient back to its normal down lower position. We're going to go ahead and get rid of all of our stuff. The patient's telling us he's feeling great. So we're going to go ahead and put on here, perform hand hygiene. Put on fresh pair of gloves. And then we're going to go ahead and get rid of everything. In our little bin. Garbage. Garbage. Perform hand hygiene. And that's done. So here's my patient. And I went ahead and did a nice little tie. And that's it.